Hi, this is Bill Hartman from Indianapolis Fitness and Sports Training, and I wanted to discuss a little bit about how we assess our young athletes in regards to their risk of ACL injury. So this is the ligament that's in the inside of the knee that is commonly injured. Most of us have seen some of these injuries occur on TV, or at least we've read about them somewhere, so everybody's somewhat familiar. And today I'm going to show you a little bit about how we test these things dynamically. Now, before we do that, I just want to touch on a couple of other aspects that we'll use in regards to our assessment of an athlete's ACL risk. First, we're going to consider their sport. So we tend to see more ACL injuries in sports involving courts, such as basketball or volleyball, and field sports like soccer, where the foot is actually grounded, and this can put increased load or compromise the position of the knee that makes an ACL injury more likely. We'll tend to see more ACL injuries in our athletes in their late teens. So as athletes move into their high school years or junior high school years, we'll tend to see more injuries. And then the rate tends to fall off, which you would expect because most kids do stop playing organized sport in their late high school years. There's an unfortunate bias against female athletes. We tend to see more ACL injuries in female athletes, and we'll touch on that as we go through a series of blog posts on ifastonline.com, as well as some of these informative videos. As part of our ACL injury risk assessment, we're going to look at a lot of joint mobility issues. There's a lot of things that can potentially influence how the knee is positioned and how the knee is loaded, and joint mobility certainly plays into that. And then we're going to see how our athletes respond to certain dynamic tests. And that's a little bit of what I want to talk about today, is one of the dynamic tests that we use, which is very, very simple, but provides us a great deal of information. So this dynamic test that we're going to use is simply a step off of a 12-inch box, and then we're going to look at the landing mechanics. So there's some information in the research in regards to how landing mechanics occur that may predispose certain athletes to an ACL injury. And so we're going to use this 12-inch box step off. And so this is Artem, and Artem is going to step off the box, and then he's going to sort of stick his landing there. And so what we're going to do is we're going to look at those landing mechanics, and there's certain aspects of the landing mechanics that I'll go through in detail here in just a minute. But I just wanted you to see the test from a couple of different angles. And so we'll watch him step off from the front. And so you can see, again, he steps off, he sticks the landing, and then holds his position for us. And we'll use this test for both males and females. But what we want to look at is the typical response to the landing forces. So as you can see here, we got the static picture of Artem coming off the box, and you can see that he maintains the space between his knees. His knees and hips are bent, and you saw him a little bit from the side view where his hips are going to be behind him a little bit, and we'll show you those in just a second. But what I want you to pay attention to is the opposite of how Artem landed this jump. So in athletes that tend to have a higher risk of ACL injury, we'll see this valgus position of the knees. And a lot of times what this gets blamed on is weakness in the muscles that surround the hips. And I want to offer you another answer to why this type of landing mechanics actually occurs, and it's typically not associated with weakness in the hips. It's actually a reduction in the ankle mobility as athletes will land these jumps. So how does this happen? If we look at the landing mechanics from the side, we want to look at the shin angle, and then we want to look at the hip position, because both of these play into the position of the knee upon landing. So if you look at the picture on the left, you'll see mechanics similar to how Artem actually landed the jump. So we have a relatively vertical shin angle. So the knee's slightly forward of the ankle, but it's still relatively vertical, and then the hips are back. And what this allows him to do is distribute load throughout his lower extremity and throughout the trunk. When we see the landing mechanics associated with the valgus knee or the knock knee position where the knees get closer together, we see a forward shift of the center of gravity. And so what this does, it moves the knee further forward over the toe, and it maxes out this ankle mobility, and this is actually what drives the knees closer together. So the pelvic position and then the ankle position are what move the knees closer and closer together. So during dynamic activity, where you're actively resisting the forces, the forefoot, the front of the foot is going to press into the ground, and that may actually limit the ankle mobility and drive these knees closer together much sooner during landing mechanics. And this moves the knee into that valgus or knock knee position. I'm going to back up and show you that again. It moves into this knock knee position, and this is actually no man's land for the ACL. So this is typically the position of the knee where the knee is less bent and it's moved inward into this valgus position, and this is where the load on the ACL can occur. Now, because we're looking at a total body position having an influence on the knee, trying to strengthen some muscle in isolation really is not a viable solution to helping reduce the ACL injury risk. So what we want to do is we want to teach the athlete an exercise that teaches them how to manage their center of gravity, how to load the trunk and the hips and the lower extremity together, and keeping the foot effectively on the ground. And we can do that simply with an activity called a plate squat. So I'm going to let this video run. And so what we're going to do is we're actually going to move the center of gravity backward by pushing load forward. So Artem is actually reaching forward in this regard. He's pushing the plate forward, and you can see that it immediately shifts his center of gravity backward. So we're no longer loading just the forefoot. We're actually loading the entire foot, and this is going to allow him to sit back into a squat, load the hips and trunk effectively, and then allow him to access normal ankle mobility. So over time, the athlete learns to manage their center of gravity, and then we no longer have the resultant deficit of ankle mobility issues and pelvic position issues, which will actually increase the load on the knee. Now, there's other issues that we're going to address, not just this exercise. It's not a one and done solution. We have coaching issues in regards to landing mechanics that can solve this problem simply. We have other aspects of adding strength, power through common plyometric activities, jumping activities, and as I said before, adding strength on top of good alignment and control. Couple this with a proper conditioning program, as fatigue is going to affect this as well. But what I wanted to show you is that we can do something very, very simply that impacts a lot of things that can influence our injury risk. We'll be showing you other videos in this regard that address many other aspects of how we determine ACL injury risk, and then how we actually manage these issues and address them through their strength and conditioning program, so we walk away with a much healthier athlete and a much lower risk of ACL injury.